This segment offers tips on preparing for your return home after surgery, as well as advice about using your motor vehicle. We recommend that you free up the areas where you walk to make it easier to get around with the walker once you are back home. Please look at the living room on the screen and identify what could be modified to make it easier to get around with the walker. In fact, several changes can be done here. First, the leather footstool can be an obstacle to sitting on the couch when using the walker. Second, the rug could also be a problem because it creates a risk of falling. Slippers can be stored elsewhere to keep them out of the way. And the chair could also be moved back to the right of the screen to leave more travel room. You can now see how the space has been freed up by following the recommendations, making it much easier to move around the living room with the walker. This example is simply to get you thinking about what you might be able to do in your own home to free up as much space as possible to facilitate your return home after surgery. We also suggest that you place items used frequently within an easy reach. For example, put food on the top shelves of the refrigerator. Another example is to have toilet paper close at hand in the bathroom. You should also place pots and pans on the counters or within reach to avoid having to bend down to pick them up if they are on the bottom shelves of your cupboards. Similarly, you can put the clothes you wear most often in the top drawers of your dresser. In other words, pay attention to the places where you need to bend down in your daily routine to minimize them. There are a few limitations to driving that you should apply after surgery. If you had surgery on your right knee, you should refrain from driving for the following 6 weeks, since the right leg is used extensively for driving, whether the vehicle has a manual or automatic transmission. This will give you the chance to recover the strength and coordination you need to drive safely. If you've had surgery on your left knee and your vehicle has a manual transmission, the recommendation is the same. Refrain from driving for 6 weeks after surgery. If you've had surgery on your left knee and your vehicle has an automatic transmission, you'll be able to drive once you have finished taking your opioid pain medication. The important thing is just to be fully alert and safe behind the wheel. What's more, you'll probably need some equipment after surgery. Since this will be temporary, several CLSC partners in ST lend equipment free of charge. Usually you'll be loaned equipment such as a walker, like the one shown on the left of the screen. A rollator, such as shown on the right side, is not recommended for the period immediately after the surgery. The walker offers greater stability and doesn't require you to use the brakes if you feel weak or lose your balance. You may also need to have a support frame installed on your toilet to provide you with handrails to facilitate your transfer to the toilet. Lastly, you might need a raised toilet seat, but this depends on a number of factors, including the height of your toilet and your own size. If you think you might need this equipment after surgery, it may be requested when you come to the pre-surgery clinic. Otherwise, the equipment may be requested during your hospitalization once your surgery has been performed. This concludes the presentation of the surgery preparation information put together by the occupational therapists for patients at CHU Hôtel-Dieu in Fleurimont. If you have any questions, don't hesitate to ask members of your hospital or rehabilitation team right after your surgery. We wish you a successful surgery and a smooth recovery.